Welcome to Ra Online. Myself Dr. Rahul Agrawal, and today we are going to discuss about the obesities. Actually, obesity is a frequently asked questions in the DNB. Second thing, in obesity, whenever the question is asked, mostly the question is asked about the difficult airway. So therefore, we have another slides or another presentation related to the difficult airway. Here we only touch the obesity chapter. Now coming to the obesity, in obesity, whenever in exam questions it comes, mostly they will ask about the difficult airway. Obesity, then they can generally keep as a short case also. They will generally keep as a long case also. In the maximum patient, suppose patient will posted for TKR, the patient is obese. They go on asking about obesity. In the general, when we are taking history, we generally mention that the weight of the patient is this much, the height of the patient is this much. We have to calculate the BMI. Once they listen the BMI is more than 30, they will go on asking about obesity. So obesity is a very large topic, and in the short notes they are going to ask about OSAs, treatment of OSA, classify BMI, what is stop bank questionnaires. So all these things are covered in obesity. Okay, let us focus on obesity. So very first slide is about the BMI, the level of risk associated with the increased body weight mass index. So it is mostly calculated by kg per meter square. The weight is calculated by kg and the height by the meter square. So here it is a classification: underweight less than 18.5, normal weight 18.5 to 24.9, overweight 25 to 29.9, obese class 1, class 2, class 3 and super obese. So class 1 32 34.9, 35 to 39.9 and class 3 40 to 49.9, and super obese are more than 50 BMI. Okay, so here the risk of developing health problem is increased here, it is least here, it is increased here. Both the undernourishment, underweight is also increased, both in the overweight is also increased. Plus in class 1, class 2 and class 3 it is high, very high, extremely high and exceedingly high. So this is the normal range of obesity, 18.5 to 24.9. Coming to the metabolic syndrome, it is a question of 5 marks in the NBE. So the diagnosis required at least 3 of the following to be present. What are the 3? Abdominal obesity should be there, elevated fasting glucose level, hypertension, lower HDL level and hypertriglyceridemia. So at least 3 should be present to diagnose the case of metabolic syndrome. If the questions come as a metabolic syndrome, we directly write metabolic syndrome is a consequences mostly present in the obesity. To diagnose the metabolic syndrome, at least 3 of the following criteria should be present, like abdominal obesity, elevated fasting glucose level, hypertension, low HDL and hypertriglyceridemia. So by knowing only these notes, you can easily answer in the exams. Coming to the clinical criteria for diagnosis metabolic syndrome. So we have told about abdominal obesity or central obesity, waist circumference more than 102 in men, waist circumference more than 88 centimeter in women. It is the central obesity. Plus any of the 2 following criteria: triglyceride level more than 150 milligram per deciliter, or specific treatment for his lipid abnormality. Suppose the patient is taking some specific treatment for lipid control, high density lipoprotein cholesterol level less than 40 in men and less than 50 in women, blood pressure, systolic blood pressure more than 30 mm mercury column or diastolic blood pressure more than 85, or treatment of previously diagnosed hypertension, fasting glucose level more than 110 or previously diagnosed type 2 diabetes mellitus. So if the patient is having diabetes, along with diabetes, if the patient is having any 2 criteria, either the patient is having triglyceride level more than 150 or HDL level less, or there is increase in the blood pressure or the fasting glucose level is more, then the patient is diagnosed to be a case of metabolic syndrome. So in the exam you have to write about the clinical criteria for diagnosing metabolic syndrome, what is the definition of metabolic syndrome, and what are the consequences or what are the anesthesia consequences in the case of metabolic syndrome. Suppose the question asks about only the definition of metabolic syndrome, at that time you have write only the definition and criteria, you will get 2 marks. So in obesity, BMI they will ask, okay, RAM position is a question, stop bank questionnaire is a question, RSI is a question. These 4 questions you have to, you will get from obesity. Metabolic syndrome is also a question. Okay, and whenever obesity is coming in exam, they will definitely go and ask about the difficult airway. So difficult airway will discuss thoroughly in the next session. Definitely they will go on asking about difficult airway. Difficult airway will cover in the next session. Thank you.